Good morning again! Welcome to my vlog. So for today's video, we are going to demonstrate the proper body mechanics and also the proper body positioning. But first, what is proper body mechanics? Proper body mechanics will conserve you the energy, reduce stress and strain on the body structure, reduce the possibility of personal injuries, and produce also movements that are safe. So let's start. So first, we are going to demonstrate is the proper body mechanics, but make sure to remember these 4 points: how big it is, how heavy it is, can you make it easier, or do we need help? So let's go, let's find out. So I have here the object that we are going to use for the demonstration. Alright. So first thing we need to remember again is to spread these two legs, and yes, put the pressure on these 2 legs, and for you to balance the gravity of picking up this object. Okay, so and do not put on the pressure on the back because it might break your spinal cords because of that. If your object is too heavy, it might break your spinal cord. Okay, put the pressure on these 2 legs. Okay, so first. Okay, so we're gonna pick up this. Remember, put the pressure on the leg. Okay, slowly go up and support with your tummy. Okay, and go. Walk to the shelf. Assume that there is a shelf in this room. Okay, so support this object with your tummy. Okay. Up and go put it, and that's all. So next demonstration is for picking up. And it's also in body mechanics. So here back open, and of course make sure that you have an object. It's a chair. And under the chair or the wall for you to support and not to lose your balance in picking up that object. Okay, so let's start. So go hold this object to support you in picking up this object. Okay, right. Then that is the proper picking up of an object. Okay. This is the proper demonstration of placing this chair from one place to another. You should push this chair and not to pull, because if you are going to pull this chair, it might hurt your ligaments. Okay, so that's why pushing is better than pulling. So place your hand in the chair or instead. Okay, turn it around and push this chair. Right? It's much easier than pulling. Doesn't hurt you anymore. So next thing we are going to demonstrate is the placing an object in one place to another. Okay, so remember that you should put the pressure again on 2 legs and pick up the object. Okay. And make sure that you properly place your body in the right position or posture. And place this object. So here again, another demonstration under the body mechanics is that the right position, sitting position. Okay, things to remember also is you should have your chair, comfortable chair with the supporter at the back, and the position of your body is at a 90 degree to 100 degree angle or right angle, and also consider that your parallel thigh should be parallel with each other. Okay, and the position of your feet should be in flat position, and of course in facing this monitor, you should find also your comfortable position. Okay. After an hour, stretch your body or rotate your shoulder backward and also forward to exercise it and to reduce the pain, okay, the pressure on it, and also your chin. Practice. You should exercise also your chin, okay. Pull it backward, okay. Pull it backward and okay, stand up and exercise your body, bend your body, stretch your body to reduce also the pain, the pressure on it. Exercise. So hello again. In this point, we are going to demonstrate the proper body position. But first, we are going to demonstrate the dorsal and the supine position. And also, before that, we should consider the privacy of the patient and ensure that the environment is safe. And I declare that the environment is safe. Okay. And next thing we should do is to put an antiseptic on your head to prevent the spread of microorganisms. And next thing we should do is to assess the patient to get his or her profile and ask her name, age, address, and if the contact is available, then we should get it also. So let's start. Good morning, ma'am. I'm here. I am LEAH HANDOC, your student nurse for today. So, tatanungin ko lang po kayo sa ilang katanungan, yung profile niyo po. May I know your name, ma'am, your age, your address, and also if available po ang contact number. And sige po, kunin po natin, ma'am.
My name is Andrea Pangaan.
Yes,
I live in Maligaya, Richard Isabela. Contact number ko po 0926-4823.
So now we are going to position the pillow now, okay? So first thing we should do is to put the pillow under the head of the patient. So please make sure to support the head of the patient with your hands, okay? And make sure that please do not touch this pillow in your scrub suit, because your scrub suit has a lot of microorganisms and it should not be touched by this pillow. Okay, so we're gonna put this pillow now under the head of our patient and support. Okay, ma'am? So, taas na po. Ayan po. Sige, okay lang po. Iwagan na po natin. Ayan. So, in doing this, we can prevent the flexion and construction or neck extension. So, are you comfortable, ma'am? Okay, next thing we should do is to put a pillow both sides of our patient. Okay, gently put a pillow both sides of our patient. Okay, then please put the patient's hand above or this on the pillow. Okay. By doing this, we can prevent the patient internal rotation of her shoulder and also the extension of the elbow. And we should put also a truncher in between the patient hands and the waist, okay? So, both side din po ang gagawin na ito. So, ma'am, maglalagay lang po ako para ma-feel niya po yung comfort. Okay, so next is the hand roll. Okay, so we're gonna put this under the head of our patient. Okay, under the tongue. Okay, ma'am, sa next naman po tayo. Okay, lagi lang po natin ito. So, by doing this, or in doing this, it can prevent the extension of the fingers and the abulation of the thumb, okay? And next is pillow under the knee, okay? Support pillow under the knee. So, Ma'am, pwede po ba natin itaas ang ating mga paa? Ayan, okay. Galing-galing naman ng ating pasyente. Galing naman ng ate. Ayan. And also, put a transfer also in between the leg, okay? So, ayan. Ayan. Para mas comfortable. Ayan, galing naman po. So, by doing this, we can prevent the external rotation of the femur, okay? So, magiging comfortable po siya. So, pwede na po siya nating tanungin. And, ma'am, are you comfortable now? Okay, is there any thing that I can help you, ma'am? So, nothing. So, that is the dorsal and supine position. So, another position we are going to perform is the Sims position. So, what is Sims position? It is used in vaginal examination. So, it is simply to secure the position of the patients during the surgery or examination, okay? So, first step we're going to do is the securing the bed and adjusting it. So, adjust it, okay? Okay, the bed. Okay, so adjust the bed and help the patient lay on the left side with the body. Gradually hurt. So, ma'am, tulungan ko lang po kayo mag-side po. Sa gilid po tayo. Harap po tayo sa gilid. Ngayon, ma'am. Hindi, kaya na po. Oops! Ayan. So, next thing we should do is to extend the arm at the back. So, here's our hand. And we should extend it up, okay? And the other hand is to put the hand in front of her face, okay? So next is the thigh will be flexed towards the abdomen with a knee down up higher. So, ma'am, ano lang po natin po? Ayan. Taas po natin. Ayan. Abdomen. So, ito po is the straight lang po natin. Ayan. So, ma'am, are you comfortable po? So, that is the spine position. So, another position again is turning on bed back to side. So, so we should put the rails down, okay? Imagine again the rails down, okay? And next is to help to find an assistant to help you for moving this patient or for moving the patient back to side. But instead, now is we're not having an assistant, is you can only do is to get this blanket and put this on the patient body. And please imagine that you have an assistant to help you to push the back of the patient. So, ma'am, at the count of 3, we're going to put you on the back side, okay? In 3, 2, 1. Okay. Okay. So, support the patient's back using your hand and put this blanket out of the body. Okay, to feel more relaxed and comfortable, our patient is need to, okay, you just need to put a pillow on the back of your patient, okay, to support her. Okay, and we should release that pressure on the patient head, and we should put the patient head onto that pillow. And this side also is we should release the pressure on her head, okay? So, and also, please make sure that your head is very comfortable and naka-relax po siya. And next is, we're gonna put a pillow in between the patient legs for her to feel comfortable. Pwede na po nakapin. So, are you comfortable now, ma'am? Okay, and that is the turning on bed back to side position. Okay. Okay, so another position we are going to do is moving the patient from one side to the other side. Okay, so we're already done with the putting antiseptic on our hands to prevent the spread of microorganism and the privacy of the patient, and we should consider also the environment, if the environment is safe, and that is we already done. Okay, so next is to assess the rails. Okay, the both rails is assessed. Okay, assess the rails both side. Okay, imagine that there is a rails, and next is to support the patient's head for moving from one side to the other side. Support using this both hands. Okay, so ma'am, i-move muna po natin ang inyong ulo po sa ibang side. Okay, so bilang po ng 3 in 3, 2, 1, 1, 2, 3, go. Alright, and next is the middle of the body. Okay, in 3, 3, 2, 1. Okay. And lastly is her legs. Okay. So, ma'am, taas naman po konti. In 3, 2, 1. Ayan, ang galing. And please make sure that you should put the hands of the patient in her midline direction. And next, put the blanket horizontally. And do not also forget to ask a patient if he or she is comfortable. Ma'am, are you comfortable already? Okay, and that is moving a person from one side to the other side. Okay, so next position we are going to do is the Sims position. What is Sims position? This usually done by in examination of the vaginal female. Okay, the vaginal examination. And first thing we should do is to turn the patient on the other side. So support the patient to turn or move the patient to the other side. Ma'am, move po tayo. Ayan. Okay, so get the grab the patient's right hand. Okay, so put the patient first, the left hand. Okay, to support, and grab the patient's right hand. Okay, to feel the comfortable. Okay, are you comfortable, ma'am? Okay. And next is put this move this leg towards the abdomen. Okay, that's the right position, and put this in straight position. Okay, are you comfortable, ma'am? Okay, and next is to put a blanket. Why we should put a blanket is to protect the privacy of the patient. Again, this can be done in vaginal examination, and that is Sims position.